Moving on from anxiety disorders, we are now going to talk about depressive disorders, sometimes also called mood disorders or affective disorders. The various names you might see in articles, literature, chapters, whatnot. And so this is a pretty prevalent set of disorders, as are anxiety disorders. And in fact, I mentioned comorbidity previously, and anxiety disorders and depressive disorders, they do have it's pretty common for individuals to have comorbidity where they experience both. Not everybody does. Some people just have an anxiety disorder or just have a depressive disorder. But let's talk about the core symptoms that we see with this set of disorders. So a lot of people are familiar with the word depression, and you might have different symptoms that you think about when you think of depression. A lot of people will think sadness. That's kind of like the most common one that people are familiar with. But depressive symptoms actually, they include a lot of specific experiences, some of them more emotional in nature and some of them actually physical in nature. And so what do we see with symptoms of depressive disorders? We see things like loss of interest in things that you used to enjoy. You see things like guilt, irritability, worry, sadness, of course, fatigue, significant weight loss or weight gain, sleep disturbances, agitation, either more movement or less movement. Let's see, feelings of guilt or worthlessness. I said guilt previously. And poor concentration or inability to make decisions. You can already see that you may be familiar that there are certain disorders like attention deficit hyperactivity disorder that involve poor concentration. Sometimes it's hard to tell, like, okay, what is this poor concentration that you see with depression, or is this someone exhibiting ADHD or another disorder that can affect someone's concentration? And we also have suicidal ideation, thinking about suicide, or actual attempted suicide. Now, if you don't know suicide, taking one's own life. Now, not everybody who has a depressive disorder will be suicidal, but when you see that, that's included in the symptom list. So the different specific diagnostic categories that fall within this general group, they all involve some of these symptoms, but they have some differentiations, all right? Oh, and one that I did not mention. Some depressive disorders involve, actually, this general, the general category, they switch things out around from time to time when they update the DSM, so I got to make sure that I get it straight. All right, we really should say depressive disorders and bipolar disorders. Depressive disorders and bipolar disorders, which I believe at one time they were lumped together as mood disorders in the DSM. I might be incorrect, but it's in my head that way. That may not be entirely correct. So depressive disorders and bipolar disorders. Now, bipolar disorders also involve a symptom known as mania. And that is, well, we'll talk about that in more detail when I talk about the bipolar disorders. We're going to start with the strictly depressive disorders. And so one of them is major depressive disorder, which could be abbreviated MDD, or sometimes people will say major depression. So MDD, major depressive disorder, this involves your more severe depressive symptoms, and it has to last at least 2 weeks. For someone to have a major depressive episode, they have to have at least 2 weeks of impairing depressive symptoms. So let's see, it involves either depressed mood or loss of interest in most activities, accompanied by 4 other symptoms from that list that I talked about that last for more than 2 weeks. And so you might say this is an acute disorder. It can last for a shortish period of time. It may not appear short to the person whose life is being affected by it. But we also have a more long-term depressive disorder. We might use the word chronic. Chronic is the opposite of acute. Chronic is long-term. Doesn't really, it's not temporary. It's part of the person's life, essentially. And so we have this other category, persistent depressive disorder, which used to go by a different name, and I have to resist the urge to use the old name. So persistent depressive disorder is more chronic in nature. You have to have 2 full years of symptoms to be diagnosed with this disorder. So at least 2 years for adults and 1 year for children. It's a long time to have depressive symptoms. Now, typically, they are more, mild in nature, whereas you see more severe with MDD, but that's a long time to experience depression. I mean, the way it was described to me one time, somebody said, imagine not remembering what it's like not to have depression in your life. Just like that's this person's normal, is to have these depressive symptoms, just part of their day. All right, now in depressive disorders, we do have one other newer category that was added after many years of people advocating for it to be added based on research showing this is a real thing and that it does impair people's lives, and we need to list it as a disorder so they can get effective treatment. And so this is premenstrual dysphoric disorder, or PMDD. Now, some people hear premenstrual and they're like, oh, are you just talking about PMS? No, because this is more than just regular PMS. And if you're not familiar with PMS, the idea of premenstrual syndrome, that you feel kind of icky in the week or days leading up to your period, many people experience something in the premenstrual period. This is more severe. So this is significant mood symptoms like mood swings, irritability, sadness, or anxiety. Here we've got anxiety lumped in with the symptoms during the week leading up to the onset of menstruation for women. Now, this was controversial when we were talking about adding it. And it got a lot of attention when medication was approved for prescription, like to treat individuals with premenstrual dysphoric disorder. A lot of people got mad and they said, well, you're taking a normal experience, something that lots of people with a female reproductive system, lots of people experience that, and you're labeling it as a disorder. And a lot of people who had those objections, they didn't understand this is more severe, all right? This is impairing. This person's life gets taken over by their symptoms in the time leading up to their menstrual period. So these are, severe impairing symptoms. And it is often treated with a combination of medication, also with therapy. And many of the depressive disorders that I talked about, a lot of times people will see effective treatment with some combination of medication and therapy. And if you've been in the world at all, you've probably been exposed to the idea that some people don't like the idea of medication for psychological disorders. I know on my social media, my algorithm is probably different than yours. Just I'm older, nerdier, stuff like that. And so I may be seeing different stuff than you, but I know in my social media stuff, every once in a while, I will see somebody who comes up with picture, video, depending on what site I'm at, or written stuff, talking about how people don't need antidepressants. People don't need medication when they're feeling down. They need exercise, or they need good diet or something. Folks, that doesn't match with what research shows about how we can help people with depressive disorders. Many people with depressive disorders, they are not going to see improvement. They're not going to get their life back unless they have medication, or medication combined with therapy, or something. They need something more than exercise. It would be nice if you could just fix all of these problems with exercise. And some people will see symptoms reduce with things like exercise, but the thing is, sometimes symptoms reduce on their own. All right, so that's why we do research, and the research does indicate benefits. All right, so please don't shame anybody who needs to take antidepressants. All right, I could say a lot more about that if this was, a higher level class. I'll just give you a little bit since this is an intro class. All right, next video, we're going to talk about bipolar disorders.